Good morning. So nice as always to know that you are joining us for another edition of 3+U. If you act quickly, you might be able to still get tickets to Dare to Dance coming up on October 28th, which benefits the Kidney Foundation. You might not realize just how widespread kidney disease is, but our first guests certainly do, because not only are they helping patients with kidney issues at their practice at CHI Memorial Internal Medicine Associates, but this year they are also on the dance floor, dancing in the fundraiser to help the efforts. Dr. Jeremy and Dr. Jermaine Hogstrom join us this morning again from Internal Medicine Associates. Good to see you both.
Thank you. Thank you.
You know, we've been plugging this with you guys for a while now, and at long last, we finally have visual proof that you really are doing it. But y'all been practicing for what, weeks now?
Yeah,
right?
for like months, since July. Yeah.
So you are kind of setting a precedent here, because the two of you are making it a trio.
We're making it a trio, which I think, if I'm not mistaken, may be their first trio. So
Yeah.
it's been an interesting experience, especially for our choreographer, our pro dancer Amanda, to have to remember both of our parts plus her own part. So it's
Did she get your names mixed up when you're dancing?
She actually knows us pretty well, I think, now. So
yeah, she's gotten a lot better. Yeah, she has us down.
So let's talk a little bit though about the why behind Dare to Dance, because of course it's a fun event. But am I right that kidney disease is more widespread, or kidney issues, than many people realize?
Yeah, so kidney disease, it affects at least 37 million Americans. So that's pretty huge. And when you think about it, it's one of those things where you don't always know that you have kidney disease until you get checked. So there's not always going to be one particular symptom. There can be in the late stages, but in the early stages, not always.
If you are, kidney stones around here are pretty common, I think. With all the sweet tea that we drink, it's almost a given for people. But if you have a proclivity to kidney stones, is that going to make you more likely to develop kidney disease? Do they go hand in hand?
Not always, because oftentimes if you clear them pretty regularly without a backup of your urine flow, you're not going to really have too much of an issue. But there can be often times where if you get recurrent kidney stones and you get severe cases of what we would call hydronephrosis, which is enlargement of the kidney, over time that can potentially cause some damage if not treated early. So
what do our kidneys do exactly? What is their function?
Yeah, so our kidneys they're responsible for helping to clear essentially the toxins and the waste products of the body, because our cells they do produce these waste products. So they help to clear them. They also help to get rid of excess fluids. Therefore, they don't build up in our system.
So if they're not functioning properly, then what you're doing is your body is not cleaning out, and so then does that affect other organs of your body as well?
It can, and often when you get in like the later stages of kidney disease, we start to worry about your heart function, because oftentimes one of the causes of mortality in patients with especially end-stage renal or kidney function would be heart failure, heart attacks, things along those lines. So oftentimes it does kind of go hand in hand.
So often when we're talking anything medical around here, we talk the geography of where we live. We tend to be in the stroke belt and this type of thing. So is diet a contributor at all to issues with your kidneys?
It very well can be, and kind of how you say the stroke belt also brings to mind certain risk factors that can predispose you to this. So this would be things like diabetes, high blood pressure, history of heart disease. When these things are not controlled, they can also lead to chronic kidney disease.
So like everything else in life, a good diet and exercise is beneficial for your kidneys? Is that the best thing you can do?
Absolutely.
Yeah, and then, but also there's other things like staying adequately hydrated, avoiding overuse of things like ibuprofen, very common, that people are on that over the counter. And I oftentimes encounter people that are taking these things like every single day. So these are called non-steroidal anti-inflammatory. So that's usually that's ibuprofen, Motrin, Advil, Aleve, that's kind of all in those products. You have to be very careful, because over time it can cause damage to the kidney.
Well, let's dig deeper into that a little bit, because you issue a warning like that, and there are certain people, I'll raise my hand on this one, who will kind of panic then about even taking it when it's necessary. So when you say overusage, you do mean daily?
Right, I do mean daily. Usually if you're maybe a couple of times a week is usually not going to be too bad. But the people that I really see the damage being done is day in, day out, sometimes twice a day on a daily basis.
For
because they're
multiple
trying to,
months.
right, because they're trying to, joint pain is the most common reason, arthritis, right?
Okay.
And so, we often try to look for alternatives, and the alternative may look something like, sometimes alternating with Tylenol, assuming you don't have any liver issues, right?
Right.
And so we try to figure out ways to mitigate so that we're not stuck on those medications.
When you mention hydration, is that specifically water, or does it matter?
Ideally,
Water usually works best. I usually encourage patients to consume at least 64 ounces of water a day. It can be more if you are more active. But that's kind of my go-to there is the water.
I have heard somebody tell me once, and I can't quote you on who it was, that overusage, overconsumption of protein can be bad on your kidneys.
So it can, I would say, I've seen it, so with people with chronic kidney disease, oftentimes I recommend to try to limit how much of those heavier proteins, like steaks, for example, right? That's a pretty heavy one, the red meats, for example. And try to go for things, usually like salmon would be more preferred, not to say don't eat salmon all day, every day, but in place of the heavier red meats and things like that.
Okay, but that's only if you're already dealing with it.
Ideally, yes. Yeah.
Okay.
Another thing I've seen when it comes to protein actually is, I know there's always the big controversy about like whey protein for people that do workouts and things. And I have seen on occasion where whey protein has caused some kidney function decline.
Really?
In my younger patients, and so oftentimes I'm having to recheck them, tell them to hold off on the whey protein. Let's see if your kidney function improves or not.
I know you both went to medical school and you have these great practices and you are cutting edge, knowing what you know. Yet, do you find yourselves often going back to the old mantra of everything in moderation?
Absolutely, same thing. So, when it comes to these risk factors in general, and of course, the main thing I always encourage patients to stay away from smoking, alcohol in moderation. And those things will really carry you through and just really help to avoid a lot of future problems.
Okay, everything in moderation except practicing for October 28th. Are you excited that tickets are still available? Are you ready for a full house?
Absolutely, absolutely.
Yeah, I think we're going to definitely start ramping up even more frequently our practices here. But we are excited, and again, it does benefit patients with kidney disease. And so, you see the QR codes on your screen, there are multiple ways that you can support, and support our teams more specifically, of course. You can buy a table, there are virtual tickets that are on sale, so if you can't make it in person, you can certainly sit back at home and watch it from the comfort of your own computer or probably smart TV. Or you can also just give a direct donation through the donation link as well. So.
And I think that I'm right in saying this. I've had these conversations enough over the years that all fundraisers, when they have a medical benefit, go to various things. I think this one, the money stays to help kidney patients in our area with things like getting back and forth for dialysis and to the doctor's visits, and it stays completely local.
Correct. Absolutely. It stays completely local, and they have a wide range of programs. They'll even cover your medications. They will help you even at home if because dialysis is very expensive, so if you can't afford bills, things like that, they will find ways to help you. So.
All right. Well, good luck.
Appreciate it.
I'd tell you to break a leg, but I think that's just in a theater production. We don't want that happening to you.
Maybe I might break someone else's leg. I don't know.
You might break somebody else's leg. That's what he said. 875-0999 is the phone number. They are taking new patients, by the way. So if you are looking for a doctor, they would love to get a phone call from you. It's CHI Memorial Internal Medicine Associates. Thank you.
Thank you.
Julia, what are you doing? We have a commercial to film.
I'm taking a break.